Most people think of a bug out bag for wildfires, hurricanes, camping. Heck, some even pack one for end of the world apocalypse scenarios. But almost no one talks about having one ready for an unexpected hospital stay until it's too late. As an occupational therapist, I see it all the time. Patients arrive without the right clothes, personal toiletries, or the comfort items they rely on to feel like themselves. So let's talk about how to pack a real life emergency bag, one that supports your dignity, independence, and comfort. Before you purge your closet or make that next donation drop off, I want you to pause. Take a second, look at what you already have, because those easy t-shirts and pull-up pants you're about to give away, they might be exactly what you'll need if you're ever caught in a pinch. Hi there, I'm Melissa. I'm an occupational therapist and proud mom of three boys. I work in all kinds of settings, from acute care in a level 1 trauma hospital to transitional care units across Minnesota. So trust me when I say I've seen it all. On this channel, I'm bringing you real life tips, OT insight, and mom life strategies to help you stay functional, prepared, and maybe even a little sane in the chaos. Let's be honest, nobody plans for a hospital stay unless it's for something like giving birth. But people get sick, people get injured, and sometimes those hospital stays turn into transfers to a transitional care unit or TCU. Think of a TCU as medical purgatory. You're stable enough to leave the hospital, but not quite safe to go home. And folks, here's where it gets real. Depending on your condition or your diagnoses, even basic daily tasks like getting dressed or brushing your teeth can become incredibly difficult. That's where occupational therapy comes in. But here's the problem. Most people aren't prepared. Loved ones rush to pack a bag and they bring skinny jeans, tight shirts, clothes that just don't work for recovery. Some rehab facilities want patients to get dressed and participate in daily routines, including going down to the rehab gym. But if all you have is a gown, or worse, one of those oversized adult diapers, it affects how you feel and how you function. And the personal items, forget it. Most hospitals don't provide your favorite lotion or socks or the hoodie you always reach for when you're feeling off. Being unprepared doesn't just make you uncomfortable, it can impact your recovery. You miss out on chances to practice real world self care with support. So here is what I recommend. Build your own hospital bug out bag. Tuck it into a closet or slide it under the bed. But ideally, store it in a visible, accessible place so it doesn't get lost or buried throughout the months. This is an emergency bag. Treat it like one. It's a safety net. You're going to be glad you packed it. I would start with soft, stretchy, easy to wear clothing. Pull up pants with maybe an elastic waistband, loose t-shirts, zip up hoodies. These make dressing and toileting easier, especially with limited range of motion, weakness, or pain. And don't forget your everyday socks, especially if you're working with adaptive equipment. And a pair of maybe non slip socks or house slippers for safety. If you have an extra pair of walking shoes or tennis shoes, throw those in too, because they're essential for physical therapy, especially for walking and balance training. I recommend packing 3 to 5 full outfits, including undergarments, and if you use incontinent products, bring the kind you're most comfortable with. Most facilities only offer those bulky one size fits all tab style briefs. It's not ideal for everyone. Next, pack those travel sized toiletries. Reuse hotel items or fill small containers with your own shampoo, lotion, or dry shampoo. Hospitals will offer the basics, they're very generic. You'll want to toss in a few of your comfortable items like maybe an extra long phone charger, a book you've been meaning to read, maybe a soft blanket or your favorite lip balm. These aren't luxuries. They're lifelines in unfamiliar places. That may sound like a lot, but if nothing else, just pack the clothing. That's the bare minimum, and it can make a huge difference in your recovery process. Toiletries and comfort items are a bonus. If you don't have them right now, don't stress. Just start with what you have. It doesn't matter who you are, how old you are, or how healthy you feel. Everyone should have a hospital bug out bag. Whether you live alone, you have a big support system, or care for someone else, emergencies don't wait for a good time. Having a bag ready means one less thing to worry about when the unexpected hits. Before you drop off that bag at Goodwill, ask yourself, what would I need if I were admitted to the hospital tonight? Take 20 minutes, build your bug out bag. You'll thank yourself later. If this video helped you, please share it with a caregiver, a friend, or someone who might need a little nudge to be prepared. Hopefully, you'll never need this bag, but life is unpredictable. So treat it like insurance you can pack in advance. Set a reminder to check it once a year because our needs and our waistline change. That shirt from last year, it might finally be ready for donation. The point is, be prepared, not panicked. You've got this. Until next time, stay safe and be well.